you find students are most surprised by when you teach about global healthcare?
Generally speaking, what I find most students are usually shocked when, contrary to the popular opinion that's kind of spread through the media and stuff like that, is that how bad U.S. healthcare ranks to the rest of the world.
What do you think about healthcare in the United States?
I think it's pretty good.
So what do you guys think about the healthcare in the U.S.?
I honestly don't know anything about the U.S. healthcare right now. I could say the same, but don't know much.
I've just heard that it needs some reform. It's been in the news.
Among developed countries, we're the least productive and effective healthcare system, but the most expensive. We rank 65th in the world.
What do you think are some of the biggest issues with healthcare today?
Well, in America, it's the cost.
Just the accessibility and the price.
Epidemic disease major component of mortality rate worldwide. For epidemic disease, it's important to prohibit the spread of disease from original source. Healthcare system and vaccination are essential to record the medical information on patients to prevent infection of disease. HPV is spread by body fluid and mother-children transmission. Main factor of HPV transmission are inappropriate use of medical instruments in direct infection. The incomplete pre-hospital trauma system in developing countries leads to cross-infection because of inadequate medical history of patients and the wrong disposition way of medical instruments, especially for African countries. WHO reports HPV carrier rate is over 8% in developing countries, whereas HPV carrier rate of developed countries is less than 2%. The introduction of mass immunization campaigns, the prevalence of HPV notably changed, resulting in a decrease of the HPV carrier rate. To be noticed, immunization coverage rate in Africa is low. It is lower than 50%, whereas other countries increase it from 0% to 90%.
When it comes to distribution of responsibility, there is a strong variation in how certain countries divide healthcare. Countries such as Australia, Canada, Switzerland, Denmark, England, Italy, Norway, New Zealand, and the United States are found to split the responsibility between different parties. According to the International Healthcare System profiles, many of these countries place the government or a separation of levels within government in charge of providing healthcare. In contrast, countries such as China, Germany, France, India, Israel, Japan, Netherlands, Singapore, Sweden, and Taiwan all show a sole responsibility of healthcare in place. All of these countries listed, with the exception of Germany, list their government as the party carrying sole responsibility. Germany's healthcare shows virtually no involvement from government, but is instead maintained by self-governing associations.
And how do you see the effects of global stratification on global healthcare?
Well, I do think global healthcare is going to be a pressing issue moving forward. And part of the reason why is because healthcare systems are expensive and require a lot of resources in which to do.
And how do you see the effects of global stratification on global healthcare?
Well, I think you see it because you see it in in poorer, less developed countries. They have a worse healthcare system, and that's the global stratification right there. Their hierarchy, them on the hierarchy, on the healthcare hierarchy, are lower because they're less developed, because they have less resources, because they have less money.
So we have a global population that's increasing in size, and it's going to continue to exponentially increase in size because people are going to be living longer in developing nations such as India and in China. We see their longevity increasing.
Whereas, America and other very developed and richer countries obviously are higher on the hierarchy, and because they're richer and more developed, and because of that, the people end up, more well off healthcare-wise and with better healthcare providers and whatnot.
So I do think there's going to be an incredible burden placed on the entire system just because of healthcare allows people to live longer. They consume more health resources, especially towards the end of life, that it's going to be a real resource challenge, I think, in 40, 50 years from now, when everyone, the global life expectancy moves from roughly around 60 years to more like 80 years, you're going to talk about more of a population explosion. So I think it's going to be a challenge in which to manage those types of healthcare systems.
The global forces that affect international healthcare are largely a result of global stratification. The developed world has increased access to healthcare compared to that of the developing world. Such forces include poverty, lack of infrastructure, and globalization. Countries with less money are less equipped to have adequate healthcare for their populations. There is a significant correlation between the countries with the highest rates of hepatitis B and the countries with the highest rates of poverty. All of the countries with a prevalence of hepatitis B of 10% or greater are found in sub-Saharan Africa, according to the World Health Organization. Sub-Saharan African countries also make up the largest percentage of the United Nations Multidimensional Poverty Index, at approximately 42%. Infrastructure is the cornerstone of any nation's healthcare system. The lack of infrastructure in developing nations is a large part of why healthcare is inaccessible in the developing world. A lack of hospitals, roads, and consistent power prevent people in developing nations from being vaccinated, tested, or treated for hepatitis B. Even in urban areas where there is better infrastructure than rural areas, slums, where the poorest of the urban populations live, do not have sufficient roads for ambulances and emergency services to access.
A study was done on AIDS orphan children in Uganda. These children were orphaned by the death of one or both parents due to AIDS. The study detailed two groups, the treatment and control groups. Students from 15 different schools either received child savings accounts, workshops, and mentorships, or they didn't, while both groups were still receiving traditional support services like counseling and school supplies. The groups were compared after 10 months of being in the study, as well as a baseline at the beginning of the study for comparison between the two. The treatment group reported having significantly reduced sexually risk-taking intentions compared to those in the control group. It's very possible that this result could be found if the study was done in poverty-stricken areas in the United States. Having economic assets has shown to have an influence and reduce sexual risk-taking intentions among adolescents in a country like Uganda, and it is quite possible that this holds true anywhere.
The worldwide demographics of socioeconomics has had a big impact on healthcare for people. In 2002, it was stated in a study by Health Affairs that 40% of people who did not graduate high school were not insured with healthcare. Of this 40%, 60% of those were low-income families, and this problem has only continued to persist over time. Oftentimes, these low-income families have had more difficulty obtaining quality healthcare from the start because of the disadvantages they face, especially in comparison to higher-income families. For example, recreational activities, good nutrition with food from the grocery store, and schooling for a higher education can all help benefit people to lead healthier lifestyles. As research has demonstrated, there was a strong association between higher rates of mortality and disease amongst lower-income families the more these families' incomes decreased. In order to spread more awareness about how to better global healthcare, it's important to take into consideration how access to it is determined by the social and economic factors that stand behind it.
The World Health Organization estimates that environmental hazards are responsible for nearly 25% of all deaths and 36% of deaths in children. The environmental effect on health is a pressing issue that tends to be overlooked. A person's environment greatly affects their health and well-being. Those living in extremely overpopulated and impoverished areas are at much higher risk for the disease, such as hepatitis B, due to the contaminated water supply and poor sanitation. The most vulnerable people cannot get their basic survival needs when the environmental factors such as hurricanes, droughts, and floods are affecting their location constantly.
In global healthcare and medicine, education serves as a necessary tool to prepare individuals on how to protect and prevent the spread of different diseases or illnesses. Thus, the need for a good education is extremely important for the welfare of any society. However, this is where the problem begins to become apparent. According to an article by the WHO, the World Health Organization, a third of all new HIV infections around the world are estimated to occur among youths aged 15 to 25, and teen pregnancy rates are on the rise in many places. Another aspect of education deficiencies playing a role in contributing to the gap in healthcare and medicine is literacy rates, along with other foundations of preventative sex education. Studies show that countries with lower literacy rates also tend to be more inclined to have more sexually transmitted diseases and infections. Also, this highlights another reason in which less economically developed countries may be more susceptible to common diseases: the role of government. In the article, WHO mentions the roles of government to offer sex education to young people to promote teenage reproductive health, yet inconsistency exists in the related initiatives in the global context. Essentially, this addresses the need for more health education, provided by the government, needed in schools to further educate a country's citizens in a time in which they need guidance and knowledge. Ultimately, education plays a major role in teaching and preventing the spread of numerous diseases. Therefore, in terms of global healthcare and medicine, the The gap between differing economically developed countries becomes apparent when we dive into the strength of their education systems and access to resources in order to fund these programs.
Despite how far medicine has come in recent years, global healthcare is still lagging behind, with many people around the world having little to no access to treatment and medicine.
This pressing issue will only become more prevalent in coming years due to the lack of effort made in order to solve this problem internationally.
Go to the World Health Organization to learn more about how we can help with this prominent issue.